Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here with us, and thanks to you and your staff for all their work on putting together a really bold and forward-looking budget proposal for this coming fiscal year. I wanted to start off by talking about prior authorization. My colleague, Mr. Kelly, and I have legislation that has garnered over 280 co-sponsors so far in the House that would streamline prior authorization. It's the Improving Seniors Timely Access to Care Act. It would streamline prior authorization in Medicare Advantage by requiring that it be standardized and electronic. I know your team at CMS has been working on technical assistance on this, and we greatly appreciate that, and thank you. This morning, the HHS Inspector General released quite a damning report on this subject, and I'd like to submit that for the record, Mr. Chairman.
So ordered.
The key takeaways from the report are that Medicare Advantage plans denied prior authorization and payment requests that met Medicare coverage rules by using clinical criteria that are not contained in Medicare coverage rules, requesting unnecessary documentation, and making manual review errors and system errors. So these are issues that we try to resolve in our legislation, and why we're working so hard to get that moving as quickly as possible. I also wanted to discuss Kidney X. I appreciate that Kidney X is included in your budget proposal. Kidney X is a public-private partnership that was established to accelerate innovation in the prevention, diagnosis, and treatment of kidney disease. Kidney disease can be extremely debilitating, causing patients to leave the workforce, to die prematurely, and the cost to Medicare is substantial. Nearly a quarter of all traditional Medicare spending is on kidney disease management. And so sadly, kidney disease disproportionately affects communities of color. Black Americans comprise 13% of the US population, but represent 33% of Americans living on dialysis. It's just one striking example of the health disparities that we see in our country. And since roughly half of all patients who are hospitalized from COVID-19 suffered kidney damage, we can expect these figures to get worse. So Kidney X, when it was conceived, there was an expectation of $125 million from the private sector and $125 million from the federal government. The public-private partnership has been extremely successful in its first 3 years, running 5 prize competitions in which we've had 65 winning innovators tackling long unmet kidney patient needs and making inroads to an artificial kidney. But for the last 2 years, the budget proposal included only $5 million for Kidney X. So we'd like to see that be higher and work to make that $25 million. And I just ask for your commitment to help us increase that to $25 million as we go forward for future proposals like it was originally conceived.
Congressman, I cannot find anything I disagree with what you said. We are absolutely prepared to work with you to try to increase the opportunities. And when you go through the budget process, we will do everything we can with the money you give us to continue the Kidney X program.
Thank you. And again, thanks for taking the time to be with us today. I yield back, Mr. Chairman.